A promising new report on America's battle against diabetes. According to the Centers for Disease Control, just over 1.4 million people were diagnosed with the disease last year. Now, that's down slightly from 2008, and the results show the first sustained decline in about 25 years. Let's bring in Dr. Kevin Campbell, practicing cardiologist and author of the new book, Losing Our Way in Healthcare, The Impact of Reform. Good to see you, Dr. Campbell.
Good to see you.
Let's get right into it. We still have more than 29 million Americans with diabetes, still very prevalent, I would say, and I think you concur. But still, why the decrease? Talk about that first.
You know, I think we're doing a better job of educating patients on the importance of diet and exercise, particularly with type 2 diabetes is associated with obesity. And if we can continue to fight obesity in our children and in our adults, the diabetes levels are going to continue to decline. Certainly hope so.
Okay, and I want to get into that a little bit later in this conversation, but I want to go here. We talk about diabetes. There's type 1, there's type 2. What's the difference and which one is more damaging to the body?
So type 1 diabetes occurs mainly in children. The diagnosis comes at age 2 to 3 and again in the teen years. And this is when your body no longer makes insulin, which is a hormone that helps us handle sugars in our bloodstream. Type 2 typically peaks around 45 and older, and it occurs because our body cells don't respond to insulin well, and it's usually associated with bad habits and being overweight.
And how many people are walking around with diabetes and don't even realize it?
You know, there's almost 40 million people in this country who have pre-diabetes and have no earthly idea that they're at risk for developing diabetes. So it's so very important that you work with your doctor to determine what your risk is.
And what does that mean, pre-diabetes?
Pre-diabetes is when you can see that your blood sugar levels are starting to rise and that you're not making enough insulin or not responding to insulin in the proper way to help reduce your blood sugar levels. And it's associated with obesity like we talked about.
Yeah, but only the doctor would know if you're a pre-diabetic. And so is that something that they normally check for? Because it's, as you said, associated with obesity, but there are a couple people, I believe, who are thin and have diabetes as well, right?
Exactly. A lot of the type 1 diabetics are very thin, and not every type 2 diabetic is obese. Your doctor, when he sees you for your annual physical, should do a blood chemistry, and from that chemistry they can tell what your average blood sugar has been over the last 90 days, and that can give them a clue as to whether you're developing diabetes.
And they can kind of control it once they catch it so early, if you will.
Exactly. The best part about type 2 is you can cure type 2 diabetes with weight loss and changing your diet. You can actually not need the medications that you might otherwise need.
Why, here's the $64 million question, or however much money you want to put on it. Why is it so difficult? Doctors like yourself, we're telling patients, lose weight, watch what you're eating, drink water. It seems like such an easy remedy, but why is it so difficult to follow that regimen?
You know, I think as physicians now, particularly with healthcare reform, we don't have the time we need to respond to our patients and engage with them and help them make changes in their lifestyle.
Well, maybe you can subscribe or prescribe, I should say, a nutritionist for the patients.
Absolutely, a nutritionist, an exercise plan, maybe get a personal trainer. The CDC only says we need 150 minutes of exercise a week. That's walking a couple of city blocks twice a day. You're getting it, you're starting. We just want you to move, do something every day.
Absolutely. Dr. Kevin Campbell, good to see you.
Good to see you. Thanks for having me.
Absolutely. Thanks, John.